ChatGerry, the fluid-solid regime switch in chronic disease, brain aging, and recovery, number 1487, VPT Sharp 048, December 31, 2025. Gerald C. EclaireMD Foundation. Category: Research Methodology and Systems Medicine. Preface: This paper was written to clarify a simple but often overlooked truth. Most chronic diseases do not fail suddenly. They evolve, they flow, they accumulate damage quietly over many years before a visible collapse occurs. Very few patients with metabolic disorders die directly from obesity, diabetes, hypertension, or dyslipidemia. These conditions are rarely the immediate cause of death. Instead, they act as long-term upstream processes that continuously stress the body. The actual causes of death or severe disability are downstream structural failures, such as heart attacks, kidney failure, stroke, dementia, certain cancers, or permanent conditions like neuropathy, related amputation, and retinopathy-related blindness. The four metabolic disorder processes: obesity, diabetes, hypertension, and dyslipidemia operate primarily in what I call the fluid regime. They are dominated by continuous change, gradual accumulation of damage, and strong time dependence. In their early and middle stages, these conditions remain adjustable and responsive to intervention. Lifestyle changes, improved metabolic control, and sustained behavioral correction can still alter trajectories. In contrast, mortality diseases and severe disabilities belong to the solid regime. They represent completed or near completed structural failure. In this regime, tissue is lost, vessels are blocked or ruptured, neurons are destroyed, and organs are permanently damaged. Recovery becomes constrained by physical structure rather than metabolic control alone, and management replaces true reversal. This distinction explains why metabolic disorders should not be viewed as isolated diagnoses, but as long-term fluid processes that gradually push the system toward a fluid-solid regime switch. Once that switch is crossed, outcomes change fundamentally. Introduction. Traditional medicine classifies disease by organ, diagnosis, or symptom. Diabetes is treated separately from stroke, kidney failure, and heart attack. Cognitive decline is separated from vascular disease. Recovery is often left to therapies or patients themselves, and is discussed without sufficient reference to accumulated structural damage. From a systems and physics perspective, this separation is artificial. The human body behaves as an integrated fluid-solid system. Blood, glucose, oxygen, and neural signals flow continuously. Vessels, organs, and neural networks provide structure and constraint. Disease emerges from the interaction between flow and structure over time. In engineering, systems that initially deform smoothly under stress, but later fail permanently, are studied using viscoplastic theory. This framework naturally divides behavior into two regimes: a fluid-dominated regime, where deformation is adjustable and potentially reversible, and a solid-dominated regime, where damage becomes locked in and recovery is constrained. In my biomedical research, I apply this same logic to the human body, which contains many interconnected organs and systems. The human body has about from 70 to 80 major organs organized into 11 major organ systems, together, containing trillions of cells and dozens of tissue types. I explain it this way to help readers appreciate how complex the human body really is. The fluid-solid regime switch. In my medical research, I divide chronic disease, progression, and recovery into two fundamental physical regimes: the fluid regime and the solid regime. This distinction is not symbolic. It reflects how biological systems respond to stress, time, and accumulated energy. The fluid stage represents a phase where function dominates over structure. Tissues are alive, responsive, and capable of adaptation. Blood pressure fluctuates, glucose rises and falls, neural circuits strengthen or weaken with use. These behaviors resemble flowing systems that can change shape without breaking. During the fluid stage, disease progression is driven mainly by strain rates and stress-strain energy accumulation. Stress intensity matters, duration matters. Energy can build gradually or rapidly. Importantly, reversal remains possible because the system has not yet crossed a structural breaking boundary. When stress is reduced early enough, trajectories can bend back, glucose control can improve, blood pressure can stabilize, sleep can normalize, cognitive performance can improve through repetition and training. The solid stage begins when accumulated stress exceeds adaptive capacity. Structural damage occurs, cells die, tissue scars, vessels stiffen or rupture, neurons are lost. The system now behaves more like a permanently deformed structure. In the solid stage, recovery becomes constrained by physical limits. Scar tissue does not transmit signals normally. Calcified vessels cannot expand adequately. Dead neurons do not regenerate easily. Management replaces reversal. The goal shifts to preventing further collapse and preserving what remains. Classification by dominant regime. Fluid-dominated stages include early and mid-stage metabolic disorders, early hypertension, early insulin resistance, sleep-related dysfunction, and early cognitive slowing. These conditions are primarily functional and still reversible. Mixed regime stages occur near failure thresholds, where flow disturbance and structural weakening coexist. Timing becomes critical. Solid-dominated diseases include stroke, myocardial infarction, advanced kidney disease, cirrhosis, and advanced dementia. These conditions reflect completed regime switches. Structural failure has occurred, and recovery is partial and constrained. Conclusion: there is one mathematical engine underneath disease progression, recovery, and failure. The distinction between fluid and solid regimes is not a change in equations, but a change in physical behavior. The fluid regime explains why early intervention works. The solid regime explains why late intervention is limited. The regime switch explains why sudden, catastrophic events often appear without warning. Most importantly, prevention is not about avoiding disease labels. It is about staying on the fluid side of the boundary for as long as possible. Disclaimer: I write this article not for fame, but to share what I have learned so others can understand health, prevent disease, and live better lives. This content is provided for educational reference only, and does not constitute medical advice. No doctor-patient relationship is created. You may share this article freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights belong to the author. Gerald C.